Hello everyone, my name is Mohammed Al Hassan and I am academic hospitalist at St. Agnes Medical Center Internal Medicine Residency Program. I believe setting expectations is very important at the beginning of any rotation. I usually hand my residents a summary of these expectations on day one, but I thought to create this video to discuss further the expectations that I have for my residents during their inpatient general medical ward rotation. And yes, the sky's the limit, and we would like to set high expectations for our hard-working residents. So let's start. So among the 6 ACGME core competencies, many believe that patient care is the most important one, and that's true. Patient care is a crucial part of our profession. But I believe professionalism encompasses all the other core competencies, including patient care, and that's why I started my expectations with it. Professionalism can have many definitions, but this one I found is the coolest one. It is doing the right thing when no one is looking, as well as when everyone is looking. I mean, you can care for your patient because it's a graduation requirement, but even better, you do it because this is just the right thing to do. So do your best to provide compassionate care for your patients, have respect to your colleagues, faculty, and all the hospital staff you work with. Watch your attire, watch your language, and generally just commit to the profession of medicine. So to know how to provide good patient care, you need to have a good medical knowledge. So have a plan to read and study on a daily basis, get engaged in discussions during rounds, and know that saying "I don't know" is okay. If you do know, share with others. Where to read from? I know many of you love UpToDate, and it's a good resource, but I would advise that you always explore other resources as well. Access Medicine has many excellent textbooks, including Harrison, and many interactive cases and many other resources as well. Dynamed is a wealthy site for evidence-based medicine. It's actually very concise and well organized. The Johns Hopkins Antibiotic Guide is also an excellent source for a quick look into antibiotics choices. New England Journal of Medicine, they have really many interesting review articles with cool images, and also many review cases to train you on clinical reasoning. And so try to do at least a case every day or whenever you have time. They're really interesting. Of course, do not forget PubMed, and also you need to know what guidelines say and what is generally considered standards of care. And of course, Google is always there. So all these resources should be free for you. If you do not know how to access them, ask your colleagues, ask me, ask faculty, or even better, ask the librarians. They really love to help. So as a hospitalist, you know that you are the primary care provider for your patient in the hospital. Final decisions are made by you and your patient, of course with the assistance of other providers and consultants. So we expect you to be the best to know the patient. How to achieve that? I advise you to keep in mind 3 resources for patient information. Of course, the first one is the patient and families. Basics are basics. I mean, we do not have a substitute for careful and excellent history-taking skills to make the right diagnosis. So make sure that you follow the basics that you learned in medical school and then modify them as you gain more and more experience. Second is to ask all those who took care of the patient before you, including previous colleagues, ED physicians, and even primary care providers in some cases, when you want to obtain, for example, prior tests or images to make the diagnosis. And electronic health records, of course, is a very important source for information, but be careful of what is called chart rumors. Chart rumors basically is that not everything in the chart is true, unfortunately, so be careful. Third resource is all those who are taking care of the patient with you right now. Nurses being in the first line. Be their friend. They can tell you a lot about the patient. They are with the patient most of the time, much more than you. Also, physical therapist, respiratory therapist, and other ancillary staff, depending on the case and the diagnosis of the patient. For example, I found it really very useful to talk to physical therapist if I am suspecting that my patient weakness is because of a conversion disorder, if you know what I mean. I'm going to read this one for you. This is your time to practice formulating your own assessment and management plan. Do not be afraid to make mistakes. We all do. Attendings will discuss with you why or why not they agree or disagree with your plan, and that will help you formulate your own plan in the future. So when you call with issues, and most of the attendings, including me, are available 24/7 when covering a team, always think about your own plan and discuss that with your senior and your attending afterwards. And we all want to really hear your plan so that we can help you modify your clinical reasoning.